Everybody knows that we have a heartbeat, a cardiovascular pulse, which you can feel in your own wrist. You can feel your own heart. You can listen to your heartbeat. Everybody knows about the rhythm of breathing. When we're breathing naturally and easily, like a child asleep, there's a certain number of breaths per minute. We can breathe really fast sometimes if we're in a panic, or really slow and almost breathless in some states of relaxation or in some states of disease. But most people probably don't know that we have a third body rhythm, which involves the whole body. It's much more subtle. The movement is harder to appreciate. But once we do appreciate it, we'll find it easily. It's easy to feel. And it affects the head, the spine, our bottoms, and our whole body. And we call this the craniosacral rhythm, or just the cranial rhythm for short. Some people just call it the tide, because it's slower and kind of fairly basic to the whole body, and can, what we say that it can entrain other faster and more obvious rhythms. And by entrainment, I mean it can kind of smooth them and catch them up. You could think of the cardiovascular pulse rate and the breathing like a little bit more like breaking waves, turbulence in the sea as the waves are piling up and coming into the beach. But after a certain amount of time, longer waves like the tidal wave coming into the beach and going out, ebb and flow of the tide, will smooth out those shorter and more tumultuous rhythms, smooth them out, and entrain them into a kind of a harmonic. So we say that the whole body cranial rhythm can entrain lesser rhythms in the body and give harmony to the whole body. Not just breathing and cardiovascular pulsations, but also metabolic rates, wakefulness and sleepfulness, hunger and thirst, blood sugar swings, and so on, can be entrained in this way. And the cranial rhythm, although it's subtle, is very straightforward. If you imagine a baby, when a baby is going through the cranial rhythm, a baby is slowly curling up and kind of expanding, or there's a little bit of sort of like a pulse of heat that comes into the body, and then a slow contraction as the heat leaves the body. So the baby would be sort of curling up and uncurling, and curling and uncurling like that, including the head, which is very important, and the whole spine, and the limbs and legs and everything affected by that. And this rhythm has been traced to the fluctuation, the changes in pressure inside the brain and spinal cord in cerebrospinal fluid, which is the clear, watery, sugary, salty fluid that fills our brain and surrounds the brain. So our brain and spinal cord are sort of floating in this cerebrospinal fluid. We shorten that to CSF. The CSF is pulsing, expansion with fresh CSF coming into the brain, and contraction as it drains out of the brain in a regular sort of beat. It's quite regular. Even in disease, you'll find that it's reasonably regular. It's there to entrain with and to be entrained by. How can I say, in the last 2 or 3 decades, this has been looked into with research. People have been hooked up to machines. In surgery, people have noticed this kind of fluctuation in this fluid. If a brain surgeon will know this, they cut you open and there's the cerebrospinal fluid and it's swelling up like a little pond expanding, and then it's diminishing down again. At somewhere between 3 and 12 times a minute, depending on the person and depending on the age of the person and the health of the person and so on. this expansion wave, contraction wave affecting the whole body has that sort of periodicity or length, wavelength. And in health, we find that our breathing, our heart rate, and our metabolic rates tend to come in harmony with this underlying pulse wave of cerebrospinal fluid. And this isn't surprising because cerebrospinal fluid sets the basic excitation level of the nervous system. The fluid itself is rich in electrolytes, that is salts, it's rich in hormones, it's rich in nutrients, and it sets the tone of every nerve in your body, including the nerves that go to the heart, that go to blood vessels, that go to your lungs, and so on. So it's not surprising that the fluid fluctuations would have a role, at least, in training the body, harmonizing the body, and getting it into sync. I think most people would find it hard to accept. Many doctors, and even some anatomists, would find it hard to accept that the head has a pulsing going on in there, expansion, contraction. But in fact, a detailed look at the anatomy of the bones and the membranes of the head will show that some areas of the head really do need to move. And particularly some of the sutures and joints in the head are designed for this movement, although others are designed to be very tight. Some are designed to glide, the beveled sutures like in the sides of your head. And one of the people who developed cranial work 100 years ago came to the idea by looking at the sort of the gills of the head. He saw them as gills of a fish almost, the breathing of your temporal bones in expansion, contraction. And the joints that are made by your temporal bones here around your ears and coming up to your temple, those joints are all beveled with a lot of glide in them. And you don't want to go home and test this on yourself, but if you were to lock that up with a belt or some kind of tight object, you would soon suffer the consequences of having a shut down cranial rhythm. There's always been a school of anatomy, the Italian school, going way back, hundreds of years ago. They believed that the whole body was designed to move, including the head, and studied their anatomy on that basis. Whereas the Polish school, developing around the same time, which has influenced most of what we now think of as European civilization and what spread around the world, was the idea that the head, although it may move a little bit in the baby, eventually becomes a solid bony case for the brain, not designed to move at all. And those two schools have been kind of battling, you know. If you look at an Italian car or an Italian designer compared to a Polish designer, you'll get the idea.